from time to memory for you that you can share with the people that you love. Hear the Appleseed every Thursday at noon, right here on the information and cultural beacon of the Four Corners, KSJE, Farmington, New Mexico.
Good morning, everyone. I'm Megan Culp, along here with Scott Micklin.
Good morning. It is Thursday, August 20th.
It is.
Week 23.
23.
How about that?
Thanks to one of our listeners who has officially taken up the helm of that because...
The counting helm.
The counting helm because I was slacking.
It's a heavy burden to bear.
It is.
We appreciate that.
She uses a paper calendar. That's how she does it.
Well, whatever works.
This
Apparently we haven't figured it out, so I'm glad that she has.
Limited staff.
Yes.
You're too busy with buttons over there, and I'm too busy.
I am.
Not focusing.
True. But we have the musicians are back, so we had their theme music today, so we appreciate that.
Musicians. The live band.
Yeah, the live band in the pit down here.
The pit. That's good.
There you go. But anyway, we're glad that you're with us, everyone. We have a great show, again, to share local information about COVID-19. In fact, we'll be hearing later from Dr. David Scrace, of the New Mexico Human Services Secretary. Yeah, I think it's a big get for us, that he's sat down and talked to us.
Yeah,
he's willing to
he's the doc. He's
return my phone calls.
He was the Fauci of New Mexico.
Right.
Which is true. That
the
is
New Mexico
his
version of Dr. Fauci, kind of. But yeah, I think, he has a good understanding of what's going on, the numbers, and we've asked him to kind of drill down into the Northwest New Mexico numbers, because when we see him on those statewide press conferences, it's more of a statewide look, or they're focusing on maybe Albuquerque, Santa Fe. And so anyway, today he's going to talk about Northwest New Mexico. Interesting
minutia is how I would describe it.
Yes.
About rules of ratio and all of that. So
exactly. Yeah. So what's happening? We want to remind everybody about the testing that's happening this week, of course, again, later on today here at San Juan College on August 20th, 6 p.m. to 7 p.m. And tomorrow morning here at San Juan College on Friday, August 21st from 7 a.m. to 8 a.m. And another testing opportunity on Saturday, August 22nd, over at the San Juan County Public Health Office at 355 South Miller Avenue from 8 a.m. to 9 a.m. So just important to kind of know where the free COVID testing is taking place from the Department of Health. Of course, other entities are giving out COVID tests as well, but these are the ones that are sponsored by the Department of Health, which are free. Even if you don't have insurance, they are free to go to.
That's right. So register beforehand.
Right.
And
there you go.
And it's not that bad, I would say.
You are a person who's done that. You've taken the test,
right?
The test,
personal experience. You'll be fine.
Okay, so there you go.
It's quick and they're nice.
There you go.
Yeah,
that's all you can ask.
That's all you can ask.
Quick and be nice.
Yeah. So seriously.
Yeah. So there you go. Let's talk about numbers,
right?
You've got
numbers.
Johns Hopkins again. We always watch their dashboard. They are keeping track, of course, of the numbers across the world and the U.S.
That's right. So U.S. confirmed cases as of either this morning or last night is when they update it, is 5,530,655 cases. U.S. confirmed deaths, 173,204.
Okay. That's where we are today.
That is where we're at.
Right. And so again, the numbers I believe are kind of trending down. We're not seeing as many new cases per day.
That's right.
As we
We had
have
a
been
15% drop this past week in
the
new
past,
cases.
and so that's good. And of course, I know a lot of the experts will tell us, the daily numbers are kind of hard to look at and get any kind of bigger picture. It's those averages, 7-day averages and things like that, and so that's kind of what we're looking
Right,
for.
including the deaths, because it takes a while for that. It can take up to a week for that information to like funnel down into the macro picture.
Right.
So.
Very true. We can take a look at the numbers in New Mexico, of course, from ksje.com. These are coming from the State Health Department, again, as of yesterday. That looks high to me.
It might be, or are you just saying
No,
it
it's
hasn't
not.
been refreshed?
No, I think it's been refreshed, but I think it's under 200, and I think that's okay. So we had 174 new cases yesterday in New Mexico. Again, in San Juan County, we saw 10 new cases. That's accurate from yesterday. My apologies, everyone. It is correct. One additional death in San Juan County yesterday. There were 6 more deaths in New Mexico, and about 174 more recoveries, and we're now at almost 11,000 recoveries in our state.
Good.
So there are those numbers, and again, ksje.com has more information on those, the daily statistics there, and then the Navajo Nation numbers, again, are 9,500 cases across the Navajo Nation, 14 additional new cases. Their numbers are down as well, which is nice to see. 4 additional deaths across the reservation for 484, and again, they've had recoveries of about 90,000, is what it says.
Wow.
Yeah. No, I'm sorry, 6,900 recoveries. That's better. That's a better number.
Yeah.
Yeah. They have given out 90,000 tests.
Okay, yeah, we're struggling with
beg
the
your
info.
pardon.
Got it, okay. It is tiny print.
It is tiny print.
In your defense.
Thank you.
And you are middle-aged.
Thank you.
The tiny print can be a struggle.
Let me grab my reading spectacles to continue the show.
Your monocle?
My monocle.
I feel like with the
What
way...
am I, Mr. Peanut?
Yes.
Deal.
I mean, you're always dressed in a tie. And
I see. So
it
I need a monocle.
fits.
Okay.
Maybe that'll be your week 30 present from me.
A monocle?
Like a monocle. Like a anniversary gift or
Do
something.
they sell those even in this century?
On Amazon, you can find basically everything.
I suppose that's
Yeah.
probably true. Okay. Well, I'll look forward to that.
Cool.
All right, very good. San Juan County also updating numbers, of course, of local information, which we appreciate their doing this. So again, these are the latest numbers from San Juan County. Again, the red line is the state of New Mexico COVID-19 cases. The green line is the Navajo Nation cases, and the blue line are San Juan County cases. We can see everything is trending down, the averages, which is what we want to see. You can see that big spike in the state, again, back at the end of July, and that was what got the state folks all nervous and concerned and shut things down again to a certain degree. But again, even those numbers are coming back down. The Navajo Nation numbers coming back down, and again, the San Juan County numbers, the cases are coming back down as well, under 200.
Right, and usually the governor's address is on Thursday afternoon, so keep your eye out on our webpage for updates on that.
Exactly. The other San Juan County cases, again, this is a little harder to see, but the yellow line is the San Juan County cases, and the blue line is the deaths from COVID-19. So again, a little bit of an uptick here from 44 cases to 54 cases on average, and a little bit of uptick on the blue line of the deaths from maybe around 2 and 3 to 4 back from about a week ago as we average them out.
Yeah.
So that's what we're looking at.
Helpful. Thanks to the county for those graphs.
Indeed. We appreciate that. So there you go. So that's what we have. We're ready to hear from Dr. Scrace?
Yes, let's do it. Let's
Okay.
roll the tapes.
We'll roll it as they say. Very good. Here we go. It's Wednesday morning here on KS. Joining us live this morning for an update on conditions in northwest New Mexico revolving around COVID-19, Dr. David Scrace, the Health and Human Services Secretary for the state of New Mexico. Dr. Scrace, welcome back to KSJE.
It's great to talk to you again, Scott, and thanks for having me.
Thank you very much. And so let's get started. The last time you and I spoke, and Megan was here too, speaking with you in May, Conditions were quite a bit different, I think, in the northwest quadrant of our state compared to where they are now. Can you give us kind of a snapshot on how things look today?
Yeah, I would love to. And I'm going to bring a slide up for those of your folks who can actually see them. I think it helps tell probably better than anything else the story about what's going on in northwest New Mexico. So let me just see if I can, there we go. So the dotted blue line is the average daily number of cases as recorded by when the specimen was collected, when the swab was obtained in New Mexico. And it's sort of the sum total of all 5 regions. And you can see back when we talked last time we were in this region here in late April, early May, where most of the peak that we were seeing in New Mexico in general was coming from this orange line, which is the Northwest. And the Northwest at that point in time looks like it represented between 2/3 and 3/4 of our daily cases. And as you all went through that very difficult time with very high daily case counts up in the Northwest counties, and it gradually came down, so did the state. We had another peak in Otero County, and then the big peak in New Mexico that was mainly driven by the central region, the metro region of the state, and primarily Albuquerque, Bernalillo County. If you keep following the orange line, though, for those of you who can see it, you can see there's been some bumps, steady decline, and then another bump in late June, and then another bump in late July. And one of the things we're learning about COVID here in New Mexico is that we seem to have these bumps that occur within about 4 to 5 weeks of a holiday weekend. And so everybody enjoys, and I do too, or used to, enjoy getting together with a broader extended family for a holiday weekend. But there's a lot of transmission that occurs during those times. And so the reason I'm bringing that up is we saw a bump in cases after Memorial Day that took 4 or 5 weeks to develop, further a surge in cases after 4th of July, and we're really reaching out to the people in New Mexico, asking them to stay home in smaller groups this year over Labor Day to try to prevent further spread of the disease. And if you don't mind, Scott and Megan, would be okay if I did our little commercial for Labor Day? Would that be all right?
I think this is perfect time for it, Dr. Scrace. Go right ahead.
Great. Just people want to know. I think we realize at the state we spend a lot of time telling people what not to do, but we also want to tell you what you can do to keep you and your family safe and still enjoy this really important holiday where we celebrate all the workers of America and all the work we ourselves do. First one is just celebrate with your household. We still have a limit on gatherings, and we know it's strictest in the country, but it's getting good results. And so try to just celebrate with the folks you live with. Try to stay outside if you can. We know that the outdoors is a little bit safer than indoors. Don't have the dining area. Keep people separated, because when we have masks off and we're close to people, that's more of danger. Remembering to wash your hands. It's important. Disposable utensils are not a bad idea either, so you don't have multiple people handling utensils. If you're going to have people over and you can still stay under that limit of 5 people, maybe have them bring their own food and drink. So, you do not want a buffet laid out to have everybody eating from the same, scooping things from the same bowls and touching the same utensils. And, I know it's a holiday and I know you're with family, but you still need to stay 6 feet apart from folks when you're in this, when you're having a party like this. And so please try to keep that in mind. And then again, wearing a mask, especially, if you and your household can choose whether you want to wear masks or not. Most households choose to not wear masks, particularly if it's a small family unit. But if you have folks in from the outside, mask wearing as well. So I just wanted to go through those. I'm going to stop sharing my screen now, but I probably will have other slides in a little bit that I'll bring up. But for now, let's go back to just talking.
Sure, thank you.
Yeah, that makes sense. Thank you so much. Let's talk about the capacity rules here for a bit because, like you said, 5 people is where we're at, and that might seem strict comparative to the other parts of the nation. Can we talk about how we arrive at these capacity rules?
Yeah, so the way COVID spreads is when people contact other people and breathe the same air. That's really how COVID spreads. And so the more people you have in contact with each other, the more COVID will spread. And so I think initially there were states, we had countries ahead of us and we had states ahead of us a little bit here in New Mexico. And so what we were doing is looking at capacity limits in China, South Korea, Europe, New York, Washington, California, and seeing what seemed to be impeding growth of the cases and what didn't. And a capacity limit of 100 was not working in countries and states. 50 was not working. 25 did not seem to be working. I think we considered 10 and 5, and I don't remember the exact order, but settled on 5 just because the more you increase it, the more you spread the disease. So it was not the number 5 itself is not a scientifically derived number. It's more of an observational statistic based on experience in other states and countries.
I understand. And Dr. Scrace, here in the northwest corner, of course, we've got 4 other states in pretty close proximity, all with maybe varying degrees of health orders and things like that. I know that's got to be a bit frustrating for folks in your line of work when you're trying to tell us all to stay home and socially distance and keep around just 5 other people and things like that, yet you have the mountains beckoning for folks to maybe go and just hike by themselves, yet they're crossing those state lines, or maybe the idea to dine out in another state that has different rules. Is that a little bit frustrating for you, and what would your advice be to folks living here in San Juan County about maybe just crossing the state line or not? I'm getting older, and so I've learned not to be frustrated with things that are completely out of my control, and there's nothing more out of my own personal control than what goes on in Colorado, Utah, and Arizona. So I think if I had advice to people in, the northwest corner of the state, I'd say pull up some internet sites, Google how we safely reopen, and see New Mexico there in yellow compared to bright red states all around us. What we're doing is actually working. And if you want to keep you and your family safe, stay home. Don't risk going across state lines. And I think that taking a hike in the wilderness, the example that you cited is, that's a good one, but there's some very, very pretty hikes in northwest New Mexico as well. And the other thing I've said in some press conferences is, unfortunately in a pandemic, there are some things that just have to wait another year. And so I think if you prioritize safety for yourself and your family, then the best choice is to find things to do within our state borders and trust that what we're doing is working based on external evidence, not just what we're saying, but external evidence. And I could probably, in very short order, that's what I said anyway, bring up an example of that website just to show people as well. But anyway. Okay, thank you.
Great, thank you. And let's talk about schools, because schools started this week and they all started online, and maybe that might change later. But what are the predictions around maybe having to move in and out of online instruction, in-person instruction? Is that something that might ramp up during the flu season especially?
Yeah, it's a great topic. We've spent an enormous amount of time on modeling for schools. We're working very closely with the huge computers and brilliant people at Los Alamos National Lab to do very, very detailed modeling here in New Mexico based on our own data and what we expect. The one thing that's most striking, well, the two really important concepts. Number one is that where you start has way more influence on where you end up than anything else. So For example, we did our initial school modeling in early June. If you remember, back then we were having 100 cases a day, 110 cases a day. And the outcomes for kids going back to school, particularly half-time in the fall, looked really, really good. Then we reran the model at the end of July when we were having 325 cases a day, and the outcomes looked absolutely horrible. And now we've just rerun the model. Analysts just rerun the model, presented that to our modeling team yesterday, and they're looking good again. So that's point number one: is don't reopen schools when your state is not in a good place. And we mentioned this last week, but Georgia, Alabama, Mississippi, Oklahoma, and Indiana opened schools and immediately had to quarantine hundreds, if not thousands, of students. New Mexico, and I'm just going to switch the math for a minute. We have 72 cases per million today, which is actually a pretty good number. South Carolina, Georgia 257, Alabama 190, Mississippi 236, Oklahoma 166, Indiana 127. So some of these states have 4 times as many cases per day corrected for population, and they reopened schools. If they've been using New Mexico gating criteria, they would have not reopened schools, and they would have saved themselves the trouble, the embarrassment, the rework involved in opening schools, shutting them back down, quarantining so many kids, et cetera, et cetera. So that number one is where you start is the most important thing. And we're getting to a very good place. So people should be optimistic about that. Second thing is that, and this surprised me a little bit, but the 2-day-a-week school is way, way safer than the 5-day-a-week school. 2-day-a-week school, we might see an increase in cases, in the 28 to 40% range. 5-day-a-week school, according to the models, cases triple go up to a factor of 5. And so I think that the governor is really on the right track with starting slow, with a smaller group, getting that experience, taking a next step, sort of taking the stairs one step at a time rather than sort of the high jump approach that other states have taken. So, and for your listeners, if you want your kids to go back to school, please follow all the advice I gave earlier about Labor Day, because that's going to be really important that we not spark a whole nother outbreak that would show up at the end of September and early October and put pressure to close the schools again.
Understood. And Dr. Scrace, we just have a few minutes remaining with you this morning. I wanted to ask you about the numbers that we were seeing. You kind of shared the graphs earlier as we watch those daily numbers, and I know you kind of get a broader look when you look at the 7-day averages, but it seems like our entire state is heading in the right direction, and that is certainly what the governor seems to be depending on, looking at those numbers when she's making her public health orders. Is there anything we should be watching for in the days or weeks to come about what the governor may have to say about the public health orders, about maybe schools reopening after Labor Day or those types of things? I know in-person dining folks are concerned about and doing some of those other things. Any predictions?
Yeah, great question. And let me take you to the website that we use. Anybody can access this. If you just Google public health gating criteria, NM, you'll get right to this page. These are our criteria. This number, all of these are within range now. We've added a couple because we've learned, because of the novel coronavirus, it means new, that there's more important things to measure. So daily case count, you just mentioned, rolling 7-day average. It's different than if you just take the numbers from the daily press releases, because we're taking the date that the swab was taken. But this is going to be updated today, and that number will be the 8th number to meet target. And so we will be within our gating criteria. And remember that the purpose of the gating criteria is to answer this question. How will we know when New Mexico is ready to open up a little bit more? And the answer is when we're meeting these gating criteria in a sustained fashion. And so we have not yet defined sustained, but I think if we keep doing what we're doing now, that there's no question that we're going to be able to have some kids back in school at least part of the time. But again, cautions, this is really, all these numbers just reflect the behavior of folks in New Mexico for the most part, and the extent to which we wear masks, the extent to which we keep that 6-foot distancing. We're really careful about having social gatherings and avoiding mass gatherings and close indoor spaces with masks off with people that aren't in our direct family. I think the better chance we have. So in the end, it isn't about state officials making decisions. It's about what we all do as New Mexicans, acting in a way that promotes the health of ourselves, protects our families, and protects the people who are around us. As one person said early in the pandemic, every time I leave home, I pretend I have COVID, and so does everybody else, and I behave appropriately. If we all did that, we could sustain returning to school for kids, maybe not 5 days a week, but over a much longer period of time.
I understand. Well, that's a great resource, again, to be available to New Mexicans, Dr. Scrace, and we thank you very much for your time this morning. We always appreciate it.
Thank you, Scott. Thank you, Megan. You guys both have a great day.
All right, and you as well. Dr. David Scrace from the New Mexico Human Services Department, our guest here on KSJE. We appreciate Dr. Scrace very much, again, back here in the studio, and lots of good information.
Yes.
Once again.
Yes.
We appreciate that. Spending some time with us and putting this into perspective, I think, too. And we'll see what the next press conference from the governor and from him, from what he has to say.
Yes.
So there you go. One final note before we go.
Yes. You want to hear
got?
an interesting story?
Why? Why would I not?
It's interesting story about stories.
Is it about monocles?
Total meta. It's not about monocles,
okay.
Unfortunately.
All right.
What it's about is, and this is particularly pertinent to our times because we hear all sorts of facts, right? That's the, like we give daily numbers, and they're big numbers, lots of, and at some point that number grows so large that our brains aren't really able to latch onto the magnitude of it. But when we hear personal stories, we get it, so to speak, right?
Okay,
And
yes.
so there's a science behind science story. Why am I holding this?
I don't know.
Do you want to just reference what this is?
Well, that is from the census,
Yes.
and so apparently that was left from a previous guest, and you have found it.
Yes, and it's like a stress ball, which is even better.
There you
so
go.
Stressed out. Okay, so it's the science behind scientific storytelling, and that's something that scientists by nature want to just rely on data, right? But they are discovering, particularly during times like these, that storytelling is really more effective. And so what happens in your brain, this is crazy, your brain spends half of its wake time daydreaming. They say it wanders about 2,000 times a day.
Right. Oh, yeah. Oh, I know.
Right.
Yeah.
I mean, you just have to look at us to understand that one. And so anyway, so there's something called neural coupling. And basically that means that when I'm telling you a story, your mirror neurons, which are things that exist in our brain to help provoke empathy, is the way to think about it. So when somebody's frowning, usually you don't smile back at them, you mirror them. And a lot of that is automatic. And that's so your brain is actually neurally doing something.
Right.
And when you tell a story, it's activating multiple parts of your brain, as opposed to when you hear a fact, it's activating less parts of your brain. And every time we hear a story and we engage in it, it evokes more empathy and sensitivity in us. And part of that is that when I tell you a story, your brain might be working on its own memories because it's, trying to relate. So it evokes memories in you as well.
Sure.
So anyway, so that's just to say that seek the stories, right, about this trying time, because they exist, and that might make us more, not just more empathetic, but more willing to stay the course. At week 23, we're all pretty exhausted at this point, and especially school starting, and every parent is like, oh, okay, it's worth it. Let's just, it's a lot. And so
I think that's a good point.
Story behind story.
I like that, because I think I do, and I think sometimes even we hear by sharing a lot of the numbers every day, and they just kind of blur over time.
They do.
To be able to put it into some kind of context, which is why I like those average graphs that we can kind of see a trend over time, that helps it put a bit more perspective, but also then hearing from actual people
Yes.
that can tell their stories,
Yes.
the teachers, those doctors, the folks on the front lines, I think that actually has a bigger impact
Right.
as well.
Survivors and
Yeah.
small
for sure.
business owners and all that.
All that stuff, which is what
So,
we
yeah.
do. So
The
interesting.
science behind storytelling.
Well, there you go.
You're welcome.
Thank you.
Yeah.
Thanks for sharing that.
Uh-huh.
Very good.
I like it.
And I think for that, we are done for today.
Let's end on that note.
But I think we should.
We should.
Yeah, I think we are. So thank you, everybody, for joining us. We'll be back, of course, on Monday with another local information, community information program. We'll be joined at this point so far by Jeff Bourgeois, the CEO and president of San Juan Regional Medical Center. We'll get an update from the hospital. We haven't heard from him in a couple of weeks, so it'll be nice to check in with him. And, of course, much, much more coming up on Monday. But stay well, stay safe,
See you then.
wear your masks, and we'll see you on Monday, everybody. Bye-bye. That was good.